Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Tips for a Successful Doctor Visit, sponsored by Prince George's County Government and the Department of Family Services.
I put this presentation together because I'm also a member of the Prince George's Senior Providers Network. And this is one of the subjects that a lot of seniors have questions about. And tonight, hopefully, I'll be able to answer some of the questions that you may have thought about but weren't sure to ask. So let me go ahead and get started. And as you see, it says the subject is tips for a successful doctor visit. Ask the right questions and you'll get the answers you need every time. And that's for everything. So let's see. First screen. Help me help you. Tom Velio is a health writer for various health organizations. He does a lot of articles on the internet. And I thought that this was very appropriate. One of the things that he indicated is that when an individual goes to their doctor's appointment, the focus is to get you in and get you out. You to get the information that you came for, and you don't want to waste anyone's time, primarily the doctors, and you should not want your own time wasted. One of the problems that I have encountered is when individuals go to their doctor's office, there's usually a wait period, hopefully no more than maybe 10 or 15 minutes, depending on the practice. Sometimes individuals can wait longer than that. And it is very important that each person understands that when you go to the doctor, you do have the right to talk to the doctor. Some doctors rush you in and they rush you out. Here in the US, most people understand that there is a limited amount of time for doctors to see patients. And usually they may want to talk, the patient may want to talk, but the doctor doesn't have time to do that. I've shared with a lot of seniors, especially the fact that insurance companies set the time allotment for when an individual can actually talk to the doctor. So the doctor knows that they only have maybe 15 minutes legally to talk to you. A lot of people don't know that. Doctor, when you go in, they want to know why you're there. They want you to get to the point. You may have other issues that you want to discuss, but you're not sure how to do that. So that takes us to how the view of doctors are changing due to the fact that we have more younger doctors that are coming into the healthcare arena. The older doctors, and I'm talking about doctors that are in their late 60s, 70s, and even 80s, there are still doctors in their 80s practicing medicine. They have a Victorian mindset. They want to tell you what you should do, how to do, when it comes to understanding what's going on with you. They don't necessarily ask a lot of questions. They make all the decisions. And for most of the older people that are in their 70s and 80s, I would say those in their 60s, we're a different generation. But most people in their 70s and 80s, if they're going to the doctors, they allow the doctor to tell them what they should be doing. They do not ask a lot of questions. And a lot of problems have come about. And one of the things that doctors did, they took the liberty of making the final decision based on limited information about their patients. And guys, this is one of the reasons why we also have an opioid epidemic among seniors. A lot of people may not think so, but it's true. So if you're going to prepare for your visit with your doctor, there are certain things you need to do. The first thing is you need to make a list of the things you want to discuss at your appointment. If you don't think that you're going to be able to remember everything, then ask a family member or a trusted friend to assist you and writing down what it is you want to discuss with the doctor. Okay? When you get into the doctor's office, you have 15 minutes to talk to him or her. Make good use of your time. Light talk, chit chat is fine, but keep in mind that the doctor is on a schedule just like you are. He or she has limited time, so make the most of it. If you're asking the question, or if that doctor is asking you questions you don't understand, ask additional questions, ask for clarification. If that doctor has information in written form, literature, don't be afraid to ask for literature about your health condition or where you can get it. Okay? You also have nurses in the office, pharmacists, and many times you have other individuals working in that office, depending on what office you're in at the time. Now, this is one of the things I did want to share with my seniors. If you have more than one doctor that you're seeing, please learn to share your other doctor's information with your primary care provider. I have spoken with seniors who may have 2 or 3 doctors. 2 of them will be specialists who are writing prescriptions. Your primary doctor may not know that the other 2 doctors have given you prescriptions. That's another way that this opioid epidemic has been able to flourish. Nobody's talking and sharing the information that needs to be shared. When you do that and everybody understands what prescriptions are out there, what you are taking, then the possibility of you becoming addicted decreases, or the possibility of you overdosing on one particular medicine that may have 3 or 4 different names is eliminated. Now, everybody is familiar that our healthcare system has changed. HIPAA regs have changed. We have more technology. We have electronic and digital health records that doctors have. Younger doctors love this. Older doctors have had to adjust to this, but the younger doctors love this. And the younger doctors actually want their patients to interact with them because they want to get to know you to provide you the best health care that they possibly can. So, again, we go back to preparing for your visit. Be comfortable with telling your doctor how you feel. Know what medications you're taking and why you're taking them. Be honest. Don't leave out details. Don't be embarrassed. There's nothing you can tell your doctor that he or she hasn't heard before. Keep an open mind. Take notes if you have to. But again, if you need to take someone with you, by all means, do so. Next slide. It's going to seem a little redundant, but it's necessary. How to prepare for your doctor visit in advance. This is information that you can share with your doctor. Say, for instance, something's going on, you're going to the doctor. You have to be able to explain to that doctor how that health issue began. If you got an ache or pain, the doctor's going to ask you a lot of questions. When you are at home, if you can, write that information down so you can take it with you. That eliminates a lot of unnecessary conversation when you get in front of the doctor. You can actually tell the doctor, I started feeling this pain 2 days ago. I have notes on how it's increased. The doctor may say, well, were you taking anything for the pain? You'll say yes. He or she's going to say, well, what did you take, Miss So-and-so or Mr. So-and-so? You already have that information down there. Well, I took ibuprofen. How many did you take? I took 2 ibuprofen. Do you know what the strength was? All that is vital because that helps the doctor to narrow how to be able to address whatever is going on with you. Okay? Now, the doctor, as it says at the bottom, it says your doctor is going to look at that before seeing you. So he or she already has a history of your medical record. That's the technology. You're going in today because something else is going on with you. So you want to be able to explain to him or her. Make a note, get a journal, keep it. That helps you to get that information quickly out the way when you get in there, because we're talking about a time factor. 2, explain how you're feeling. No one knows better than you how you feel. Some doctors prefer to ask a bunch of questions. It shows that 80 to 95% of diagnoses are made by the patient's medical history alone. That is all fine and well and good. However, you're going in because something else is going on. This is not a regular checkup. This is you're going to the doctor's office because something else is transpiring. And you need to be able to verbally explain to your doctor how you're feeling, where is hurting. And you can do this within 10 to 15 minutes, especially when you're taking your journal with you and you've kept notes. We're going to the next screen. Know what medications you're taking. Doctors love it when their patients can say, I am taking this particular medication, and this is what I understand this medication is supposed to do. They love that. They do not like it when you say, well, I've been taking this little white pill or this triangular pill, and I'm not really sure what it's supposed to do. That also goes back to the problem of getting medication from 2 or more physicians without all of the physicians knowing which medications you're currently taking. I'm going to digress 1 second. I am a holistic practitioner. I educate people about herbal products. I would never tell someone not to take a prescription drug. However, I do caution people against mixing plant-based herbal products with prescription drugs. Herbs have a chemistry of their own, and herbal products can counteract prescription drugs. Some drugs, doctors will tell you not to take and drink grapefruit. The grapefruit void out whatever that medication is. Right now in my mind, I'm so into this, I can't even think of what it is. But the point is, do not mix herbal supplements and remedies or over-the-counter drugs with your prescription medicines. Even if you're taking a multivitamin, you need to let your doctor know, because that multivitamin could also counteract your prescribed medications. And you're not trying to have that occur, because you're trying to address whatever that health issue is and get it under control. So we're going to the next screen. Be honest, don't leave out details. I've had individuals tell me that their doctor will usher them in and usher them out. They have like maybe 5 minutes and they're writing a prescription and that's it. But a competent doctor should want to know everything medical that's happened to their patient. They should be concerned about your overall health and welfare, which means that if you've had surgeries, you need to be able to tell this to your doctor. Here, for example, it talks about a gallbladder surgery. And this may have occurred many, many years ago. So you have these scars. And this also helps the person to understand that the technology has changed. Whereas in years past, people may have had large scars. Nowadays, they may have 2 or 3 half-inch scars, and they can go home from the hospital on the same day. But the point is, you need to make sure that your primary doctor understands everything that has occurred or happened to you. People change doctors. Doctors retire. which means that you're starting all over again with an individual that does not know you. If your healthcare plan changes and you switch to a different healthcare provider, if you were with a HMO, Kaiser, and all of a sudden you decide you're going to go with a managed care organization where you're seeing a doctor that's in private practice and you switched, now you're with Blue Cross and Blue Shield. Well, those people don't know you. You've got to start all over again. So you have to be able to establish that relationship. That's why it's important to disclose to your doctor everything that you're doing. It may seem like an invasion of your privacy, but it's truly for your best interest because we're talking about you're taking medications and your doctor is really trying to work with you to ensure that he or she is working with you to help keep you healthy. Are you using sleep aids? Are you taking over the counter medication to sleep? A lot of times seniors have a problem as they get older with sleeping. This is something that a lot of seniors don't like to talk about. Are you having unprotected sex? There is an epidemic going on among seniors who live in independent adult apartments, HIV. Excuse me. This is not a subject that a lot of people are talking about, but this is actually occurring, and individuals need to be very careful. So if you are considering getting involved with someone, treat that matter very seriously. Ask them, you know, about what's going on with them, who their other sex partners have been. Are they using protective sex? If you need to, go to your doctor and talk to your doctor about this. If you need other types of protection that you're not sure, your doctor or the doctor's nurse practitioner or the nurses in the office will be glad to work with you. Are you under stress? Is something going on in your life that is creating a stressful situation? Excuse me. Give me, I've got to take a little sip of water. Wet my whistle. Sorry about that. If you're undergoing stress, also need to talk to your doctor about it. If the stress is impacting your health, your doctor may refer you out to speak to someone like a therapist, psychotherapist, probably not a psychiatrist, but to get to the root cause of what's causing the emotional stress. And older people do deal with stress differently. I know that the older people in my family, many of them did not want to talk about a lot of the things that they had to deal with being a senior. I had an aunt lost her, my uncle passed. It was very, very stressful for her. She shut down. She wasn't talking. Um, and she was depressed. And everybody saw that. So there are things, life changes that can affect you to the point that you don't deal with the everyday ups and downs of life as well as you would like to. But your primary care provider needs to know that so that he or she can work with you and assist you to bring your life back into balance. Going to the next screen. Don't be embarrassed. Your doctor has heard it all. Again, we have right here where they're talking about vaginal bleeding. Okay, that is something a lot of people don't have a problem talking about. But when you're talking about somebody in their 70s and 80s talking to their doctor about the fact that they may have contracted a sexual disease, HIV, or they're abusing drugs, that can be very heavy for a senior. There's a lot of shame, a lot of guilt, it's a lot of stress. But again, to make sure that you are getting the health care and the assistance that you need during this time, please, please, please do not be ashamed or embarrassed to speak with your doctor, your primary care provider. He or she may refer you out to a specialist. Again, you need to share all of the information and details so that that person can work with you and come up with a plan of action to help you address your issues. Next screen. Keep an open mind. There are patients who go into their doctor office, and in their mind, they believe that they need a specific treatment or test because they're having this health issue or that health issue. So, in short, they've self diagnosed themselves. So, when they go into the doctor's office, as in the illustration here, they'll say, having headaches, I want an MRI. And they will badger and nag the doctor and say, I'm not going to do anything. This is what I want. This is what my health care will pay for, da 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 da. And I'm quite sure everybody knows of someone that is like that, or they've met or heard someone in the doctor's office that was giving the doctors the blues because he or she actually wanted something and the doctor was not willing to do it. So they became very loud and irate. I've seen it, most healthcare professionals have. But when that doctor looks at your medical record, he or she will make a determination on what would be the best course of action for you in relation to whatever that health issue is that you're having. And they will respectfully listen to what you're saying, but it is their responsibility to select a treatment that is going to be the best treatment possible to address your specific health issues, the ones that you came into the office for that day. Okay. And this is the perfect opportunity for a doctor to ask additional questions and assist you, their patient, in choosing a different treatment for your current health situation. So I'm encouraging everyone to be very respectful when you go into your doctor's office to talk to him or her. Your doctor, especially younger doctors, they will do whatever they can within reason to address your issues and come up with a practical solution that is going to be beneficial to you without them causing you any harm. Now, that doesn't mean that every time you go in there and you suggest something, he or she is going to shrug you off like it's not important. That's not what I'm saying. You can suggest, however, the doctor will make the decision as to what is going to be the best course of action for you. Older doctors do have a mindset. Many of them are stuck in their ways. Again, as if you are a young person, please be respectful. The old saying is, you can catch more flies with honey than you can vinegar. Season what you say with salt to your physician, and he or she, I guarantee you, they will strive to work to help you to come up with the best form of treatment possible. Our next slide. So, again, we're going to go back, write it down. We have a lot of seniors who are having a little problem with memory loss. Write down what you want to say before you leave the house. Get someone, friend, relative, to help you write your questions down. Ask questions if you're having drug interactions. Talk to the doctor again about your medications. You can even ask if he or she puts you on a new medication. When will you see results from this medication? When will my health condition improve? And because younger doctors are actually opening up to alternative therapies and treatments, you can even ask if they have any suggestions for an alternative option that could be used to address your specific health issues. For instance, chiropractors. There was a time no one wanted to go to a chiropractor because people really didn't understand what a chiropractor did in realigning the spine to help the body to improve and reduce pain. Acupuncture. No one likes needles, but acupuncture is a recognized alternative practice that can be used to address pain, which helps to reduce the amount of opioid medications or pain medications that an individual takes. So these are just a few questions that you can ask the doctor. But if you feel you're going to forget what you're going to ask, write it down at home before you get to the doctor's office. You can prepare for your doctor's visit and you have 15 minutes to talk. This is something you can always do. And there's no such thing as a dumb question. All questions are relevant. Ask the doctor. And if the doctor isn't sure, I'm quite sure the doctor will get back with you or say something to the effect, Miss Jones or Mr. Jones, I'm not sure how to answer that question, but I will definitely get an answer for you and I will get back to you.